And similarly, I want to mention that what I'm sharing is my position, my opinions, and not representing officially any organizations that I work with. And I want to dovetail on that last point. In the state of Maine, where I live and work, we've seen the exact same trend. Many years of flat past 30-day use amongst our young people, and the same thing in 2019. We've seen our first statistically significant increase amongst youth since 2009. And so we had the campaign in Maine in 2016, and that was a long campaign. It really started in 2013, so that was years of normalization messaging, and we're like I mentioned, we're starting to see that trend in Maine as well. So it's not just Vermont where that's happening. I wanted to just another couple comments about what we've talked about so far tonight. One point I think we need to understand is that marijuana is not like any other product. It is not an ordinary commodity. We can't treat it like potatoes or broccoli or anything like that. It's a substance. So yes, we do need to, as states and as a nation and as communities, we do need to treat it differently. We can't treat it like any other product. If we do, that would be irresponsible. And on the topic of responsibility, the question I would pose is it responsible, on the one hand, to go after drug companies that are causing harm in our communities while rolling out the welcome mat for another one? So if we're going to think about responsibility, I think that's something we need to think about. But there's a lot of areas when we think about states and the nation looking at how they're looking at commercialization and trying to wrap their arms around it. What we see is a lot of failures. A good example is the current vaping crisis that we're in, the EVALI outbreak, the lung injury outbreak. The CDC recently has updated, the CDC is coming out with data on a weekly basis and not a daily basis. And some of the last reporting indicated that 1 out of 6 of the vaping devices that have caused EVALI outbreak were state commercialized products. Granted, there's a lot of them that are obviously coming from the black market, but 1 out of 6 is not an insignificant number. So I think that speaks to the valid concerns that folks have about how well a state actually can wrap their arms around commercialization, because so far the track record is not really very good when it comes to vaping. Another thing that we've seen is poisonings, both with children and with pets. The Northern New England Poison Center, which covers Maine, Vermont, New Hampshire, I work very closely with Dr. Simone, who's the director there, and she reports that they're getting a large increase in calls from parents and grandparents and folks because their child has somehow gotten into marijuana and is experiencing symptoms. Same thing with pets. Pets are getting into products and becoming ill. Another piece I want to mention and kind of touch on is the taxation piece, the revenue piece, because that's something that gets talked a lot about how much money it could bring in for a state. The problem with that is what we don't do, and what no state has done, is an actual cost study on how much commercialization of THC costs a state. We've done those studies with alcohol and tobacco, and they're miserable. For every dollar in tax revenues a state collects, or the nation collects, for tobacco and alcohol, we spend $10 dealing with the fallout, whether it's increased healthcare costs, lower worker productivity, increased enforcement, because if you're going to have rules and regulations, you got to enforce them. You got to pay people to do that. Alcohol and tobacco are net losers for our states. Why don't we do a cost study on marijuana before we move forward with commercialization? That seems like it would be a responsible thing to do. Highway safety. From what I can tell, there's in the proposal here, looks like there's THC caps of 30% and 60%. That is a very high amount. And what I'd be particularly concerned about with that is particularly the edibles. The edibles is where the industry is getting the novice users. That's where they're getting new people into the market. It's with the edibles. Because we've done a very good job of stigmatizing smoking. People are concerned about their lungs, they don't want to smoke, but they can eat a cookie, they can eat a gummy bear. But the problem is that novice users aren't always well educated by the bud tenders about the delayed effect of THC. In the rural roads of Vermont, you have someone eating a 30% THC cookie. They think nothing's happened. They're good to hit the road. That's a significant issue. And I think, you know, it would be responsible to get a handle on that before moving forward with commercialization. And then the last piece I'll just kind of touch on is social inequities and health disparities. And I know that's a common theme that comes up in discussions of legalization as a way to deal with social justice and those sort of things. There again, we're only talking about one side. We're not talking about the other side. We're not talking about the disproportionate burden that our vulnerable populations bear from the fallout of drug commercialization. Alcohol, you know, the alcohol outlet density is most dense in poor neighborhoods and minority neighborhoods. Same with tobacco. And we're already seeing that pattern with the cannabis industry in states like Colorado and Oregon and Washington and others. They're not in the wealthy suburban neighborhoods. They're in the poor minority neighborhoods. Commercialization will not do any good for social justice or social inequities. It will increase health disparities, not decrease them. And that would not be responsible.